big welcome to everyone on the line today, and for those of you who will join over the next few minutes. Welcome to this Menopause at Work network meeting, which I run quarterly. So this is the last one for 2023. And these network meetings are designed for people like you to come together, to connect, to share what you're learning, and to learn from others about what does it truly mean to support people who are experiencing menopause in the workplace. For those of you I haven't met, my name's Fiona O'Connor. I'm a long-time workplace wellbeing advisor, and I've been bringing menopause literacy to workplaces for about 4.5 years now. And since then, when initially no one wanted to talk to me about menopause, apart from a few trailblazers, there's been a really big increase in public and organisational conversations about menstrual and menopause health, which is really great. And I'm seeing a lot more organisations start to ask the question, how can they be more supportive of people who are struggling with symptoms? And that's really awesome too. And sometimes part of that support offering includes the question of leave, considering whether to offer additional menstrual or menopause leave. And that's the topic of today's conversation. Is menopause menstrual leave a good idea? Now, even though I have posed that as a question, which sounds like it's just got a yes-no answer, there is no right answer to this. The real aim of today is just to get you to stop and perhaps even step out of the position you might be holding at the moment, just to apply a little bit of critical thinking and to think about this from every possible angle. And to help you do that, I've got two wonderful presenters here today who will give you some food for thought. But then I'd also love to hear what your experience is. Some of you on the line might have been thinking about this issue or have made some decisions. So yeah, we'd love to hear from you as well. So my challenge for you today is to just see if by the end of the session, you can say, oh yeah, I can see a new perspective that maybe I hadn't considered before. So I encourage you to grab a pen and doodle as our presenters talk, and to capture what's standing out for you, or what are you learning. I'm just going to launch this poll here, because just to give our presenters a little bit of an idea about what might be happening in your workplace already. So what I'm talking about is in relation to menstrual and menopause, menstruation and menopause. I might refer to it as MM for the rest of the session for the sake of brevity. And I'll just give you a little moment to complete that poll while just giving an idea about how today's session will run. So we're going to hear first from Dani Howe, who's done a global review on MM policies. And then Fiona Hitchener is going to talk from her experience of advising workplaces around leave policy, which is really priceless information. Then it'll be open to Q&A, and also invite you to share your experience. Because this is a network meeting, we will then go into some breakout rooms, because I know that one of the things that many of you want to know most is what are other people doing and how is that panning out for them. So we'll have a good, at least 10 minutes in a breakout room with 3 or 4 other people. At 1 o'clock, I'm aware some of you may need to jump off, but as the promotion said, we do allow to 1:15. So at that point, the recording is off and there's more of a chance for informal chatting from with the presenters or with each other if you choose. Okay, so that's the plan for today. Let me see how this poll is going. I'm aware people are still joining as we speak, but I think this will probably still give us a little bit of an idea of the spread. So just let me share that with you for a moment. So we've got 24% have, brought about some kind of educational awareness raising. No one to date has done manager training. One workplace has got a policy or guideline in place. A few have also approved some adjustments or accommodations. Okay, so a couple have got additional leave for menstruation, menopause. That'd be great to hear your experience. And then almost half, none of the above. Okay, so we've got the whole spread there, and hopefully that's helpful for you to know who else is in the room, but also for our presenters. And in terms of who is in the room, I'm just really aware that so many of you are already, experienced wellbeing, diversity, inclusion, HR practitioners. So that's why the breakout rooms are so important, for you to share your expertise as well as your experience. So I'm going to stop sharing my screen at this point, and I'm going to hand over to Dani Howe, who's our first presenter. And Dani, as you might have read in the promotional material, she has just recently completed a global review of menstrual and workplace policies. And I've asked her to do a bit of hard work and extract what she can from that around leave. So she's currently doing her PhD, and that's a partnership between Western Sydney University and also Endometriosis Australia. And she's looking at developing and evaluating employer guidelines to support people who are experiencing endometriosis. And Dani has had a long interest in what she calls menstrual literacy, and also trying to help us understand how inequities in menstrual health might drive gender inequality, which I find quite interesting. Before academia, she spent nearly 10 years in community and international development sectors, pretty much around the world. She's been quite a globetrotter in Canada, UK, Australia, the Gambia, Sierra Leone, Togo, Zambia, and Bangladesh. So that's great. She can really bring a global perspective. And I guess throughout all of her work, she's always maintained that interest in inclusive menstrual health education and getting that into many parts of our community. So thank you so much, Danielle, for offering to share, when you dived into some of your data, what you can tell us about what's happening worldwide and any insights about the role of leave in these policies. So over to you.
As you're doing that wonderful intro, I just realized I was like, oh, of course, one thing had to go. Perfect. So yeah, so thank you so much, Thea. As Thea mentioned, I'm Danielle Howe, or Dani. So my background's in community development and measuring social impact, particularly around menstrual health, with a special interest, particularly around, public health with a special interest in menstrual health. But I did kind of really start to look towards what employers can do to support people with public health, really in my last role. So prior to my PhD, I was part of a founding team that created a social enterprise in Melbourne where we worked with young people affected by homelessness or hardship. So I worked to develop a training and education program where we worked closely with large retailers. We worked with Nike, Nike, which I know it's called in Australia, Champion, Bonds, to place young people in their retail stores, but also train and support the HR and store managers to develop processes and accommodations that they could integrate into their already existing HR policies. So these accommodations would then help support these young people placed in their stores to overcome their barriers to mainstream employment. So I have a bit of background and experience around developing and measuring impact around policies and guidelines that provide people with extra support they need so they can continue to work and work productively and continue to have positive outcomes for themselves and their workplace. So I just want to provide a bit of an overview of my PhD. So my PhD is leading a project called Endo at Work, which is a partnership between Western Sydney University and Endometriosis Australia. So this project aims to develop a national set of guidelines for workplaces to use to support individuals to manage their endometriosis in the workplace. So this will be a first of its kind in Australia. Now, our research has implications for menstruation and menopause policies more broadly, but I just wanted to quickly touch on endometriosis. So for those who are unfamiliar, endometriosis is a painful chronic inflammatory condition. It's often associated with menstruation because it's caused when the lining, which is similar to the uterine wall, grows outside and throughout the body. The pain can often be disabling. Some people compare it to having barbed wire wrapped and twisting around your internal organs. And unfortunately, it's quite common. So it's estimated that 1 in 9 Australian women and those assigned female at birth have a diagnosis of endo by the age of 44. Previous research has shown that in Australia, the cost of illness burden for endometriosis is $9.7 billion per year. And most of those costs, so around 84% of them, are attributable to loss of productivity at work due to fatigue and pain. So when we were looking for a potential solution, it was actually inspired during COVID, and everyone was shifting to work from home. So Donna, who's the co-founder of Endometriosis Australia, was kind of saying, like, this is so awful. I can't believe we're all working from home. But I bet you there's a silver lining, like people with endo are probably having positive benefits from being able to work from home. So we actually conducted a survey. We had over 350 people responding across Australia who were all working from home and managing their endo. And what we found was that most of them reported that relatively simple accommodations, so being able to use a heat pack, being able to work while lying down, being able to take breaks when they needed to, had significant improvements in self-reported feelings of productivity. So they felt being able to manage their symptoms at work made them more productive. So now that we're returning to work, we're trying to figure out how we can incorporate these supports in the workplace so that people with endo can continue to work and work productively. So the first step in then creating these guidelines was to explore what guidelines already exist globally. So we conducted a global scoping review, which, as Thea mentioned, was actually just published last week in Healthcare. We expanded this search not only to just look at endo guidelines, but also to look at menstruation, menstrual disorders more broadly, and menopause. So we wanted to know what exists, what was best practice, what can we learn from, and what's the impact of these policies. And what's probably going to not be very surprising to you all was we found very little. We casted our search basically from 2022 to essentially the beginning of time, and we had only 62 articles that met our inclusion criteria. Of those 62 articles, only 27 actually presented or reviewed a policy around menstruation, menstrual disorders, and or menopause. So when you take a look at the data, most of these articles were actually coming out of the UK. So the UK is kind of really leading some of this research. When we look deeper into the articles, of the 27 articles that presented a policy, over half of the articles were gray literature. So this was mostly industry reports or HR policies. So this means that most of this work in this field is actually being driven by industry and by individual organizations. When we kind of look at the focus of each of what the policies were, most of the policies, around 48%, were focused on menopause policy. Now, considering how prevalent endometriosis is and the prevalence of dysmenorrhea, which is period pain, there's obviously clearly a disparity in the lack of policies to support individuals with menstruation and menstrual disorders in the workplace. But returning to look at the menopause policy and why these are so prevalent. So I mentioned in the last slide that most of the articles were from the UK. And this is because there was a significant number of articles set in the UK from trade unions and federations through their industry reports, focusing on supporting menopause in the workplace. This was, to me, a bit surprising. I was like, what is causing this popularity push from trades to focus on menopause? But when you dug a little deeper, it was actually, it may be attributed to their approach and their rationale. So what the trade unions have done is they've positioned menopause policy as an occupational health and safety concern, which bases menopause policy and practices as a legal obligation of the employer. So if someone is transitioning through menopause and is working outside in high temperatures and they have a hot flash and pass out, that's actually the responsibility of the workplace to make sure that that doesn't happen. And the unions have then backed this approach by using national legislation. So they've most commonly cited the UK's Health and Safety at Work Act. So I think it's interesting to consider as we move forward and through our discussion with the menopause policy, how this approach could translate into settings and workplaces in Australia. So to look a little deeper into some of the policies more broadly from the scoping review, it's really interesting to consider what are the policies asking of the organizations. When we looked across the articles from the scoping review, recommendations within the policies could fit into 3 categories. So the first was physical work environment. So this is making sure workplaces have access to cold drinking water, food, access to a break room or breakout space, so you could have additional leave and flexible breaks, adequate ventilation. The second category for recommendations was information and training. So promoting and conducting awareness-raising campaigns, a lot of focus on gender sensitivity training and gendered health, and that's what was really being driven by the unions. And then lastly is the policy themselves. So flexible working time was very popular, as well as additional paid leave with no medical certificate was another common theme that we were finding across the policies themselves. And as well too, that we had, it was quite common to see a process around integrating this education throughout the organization and throughout the administration of the organization. So what's the impact of these guidelines? That's what we want to know. Are they working? Again, we actually have very little empirical evidence around the impact of these guidelines. And this is so very few of the articles actually provided how they were designed, so a design process, or an evaluation of the policy themselves. Most of them were actually just the policy and the rationale for why they were doing the policy. And that's because most of the articles were industry or HR reports. And because the policies are kind of being driven within the organization, there's not really a lot of motivation for making public any rigorous evaluation or impact. However, we do have some data around organizations reporting on impact. So in the Victoria Women's Trust here in Victoria, Australia, they have a menstrual and menopause well-being policy. So they have an option to work flexible working. They offer free period products. They do training and education sessions. And then on top of that, they offer 5 days paid additional leave per year. So after 5 to 6 years of this policy being implemented, they've only had a total of 36 menstrual leave days being taken. So that's an average of 6 days per year across their 12 staff. And they're really reporting that they believe that this has developed a positive menstrual culture within their workplace. So I guess that brings us to the question, does additional leave work? Unfortunately, the answer is not so simple, which is why we're all here today. Across our research so far around developing endometriosis guidelines for employees is that when we've been interviewing HR senior leaders and managers, overwhelmingly what we're hearing employers say is, well, we have flexible working arrangements. We actually already offer X, Y, and Z. In some cases, we've actually had organizations where like, we have additional leave, we have a special leave that people can offer, and are really reiterating like these processes exist for staff already. But when we interviewed and surveyed nearly 400 people with Endo who are currently employed across different industries all over Australia, overwhelmingly people have said they cannot access these accommodations or flexibility, or probably more importantly, they feel that they're penalized in some way. So being passed over for a promotion, being given less tasks, seen as lazy or not a hard worker when they try to access these flexibilities or supports within the organization. So what I'm really interested in, what our project is really interested in, is really finding out why is there this disparity. In most cases, if someone has additional leave or the policy already exists, like why aren't they working? And so I think instead of asking, does additional leave work, we need to ask, what makes a policy work? And from our preliminary research so far, we're really seeing that in order to implement a policy, you have to integrate 3 streams into your workplace. So the first would be some sort of education stream. So this is beyond definitions. This is beyond, this is what menstruation is, this is what menopause is, and more how menstruation or how menopause affects someone at your work, and being very specific to your industry, as well as kind of promoting this education everywhere. So it needs to be in inductions, it needs to be lunchtime learnings, there needs to be posters. So that's a really important aspect. The second one is, of course, the policy itself. So I think some of the feedback we've been really getting from people with endometriosis is tangible flexibility. So not just allowing people to arrive between 9 a.m. and 10 a.m., but the ability for some people to start in the afternoons or to work at night or weekends, as well as providing simple accommodations for people to work in the office. So these can be as simple as ergonomic chairs, comfortable uniforms, access to break rooms or a breakout space. And a part of the policy recommendation, as you could see throughout the scope and review, a popular part of it was offering paid additional leave. I think from what we can some of the findings that we're leading to, it is common practice if you do want to do a little bit extra, but and it can work when it's incorporated with the rest of these streams. But I understand it's not financially viable for all workplaces. A lot of the time, though, what we're finding is that if you can offer tangible flexibility and accommodations, people might not need to access as much leave because they're able to work on their own time and they're working productively. Lastly, and most importantly, I think we really need to focus on the stream around processes. So one of the components of that would be having an HR champion or someone that can really drive these 3 streams and advocate to people for people to access these policies. The other component of these processes is getting senior leadership buy-in, and this can happen in 2 steps. So the first step would be getting executive buy-in. What we're finding in our research for some organizations, such as Victoria Women's Health, that due to the nature of the industry, women's public health, there's already that foundation of understanding and education, which really helps drive the culture. So they can more easily have an easier, I'm not saying it's easy, but have an easier time having buy-in and implementing the guidelines. Whereas what we're seeing for other organizations, due to the nature of their industry, so I'm thinking of tech companies or trades, there might be more work to do in order to gain executive leadership buy-in. And based on our preliminary findings, we're suggesting to motivate the executive team that we need to shift the responsibility from the individual to the responsibility of the workplace to provide these supports. So for instance, going back to that example of the trade unions in the UK adopting to adopt menopause leave, they framed it as an occupational health and safety issue. So by framing it in this way, and then also framing it as a way of investing or keeping workers or keeping your resources, it's helping the bottom line, and we may see a greater uptake of policies. The second step is for senior leadership to model the support offered through policies. So if you're a worker or you're a manager, never takes flexibility or a day off and never talks about it, you as the worker, you're probably not going to take it either. Because you don't want to be seen as a bad worker. You want to follow the norm. You want to be seen as a good worker. So we encourage senior leaders and managers to also take flexibility, and if they can't, to then promote flexibility and promote conversations and trust across the workplace. And so that's my time, I think. But yeah, thank you so much. And I welcome any questions or any conversation. Great.
Yeah, thanks so much for that, Dani. What we might do is we'll hold questions until after Fiona's presentation. Yeah, I like how you reframed the question, and it was found interesting that you said in quite a few cases there were actually accommodations or flexibility there, but women didn't know how to access them, or so that's part of it all, isn't it?
Yes.
So interesting to know. What stood out for me also is if anyone is implementing some leave policies, please evaluate and publish them. Yeah, for reviews like that, they're hard to find. So what I want to do now is switch and take a slightly broader view and ask Fiona Hitchener from Parents at Work to really speak to her experience of what they've found around the topic of maternity leave, which then became, paternity leave. Because I always think it's good to stop and just look around us and see what could we learn from possibly related fields. And I'm also delighted that Menopause at Work has recently formed a partnership with Parents at Work, because becoming menopause friendly is actually part of becoming family friendly. So Parents at Work, they're a leading provider that advances workplace inclusion, gender equality and wellbeing outcomes for families as well as for businesses. And Fiona is the Client Advisory Director with organisations across Australia, but also globally. So it's great she can bring that perspective. So she advises them on how to bring best practices, let's say, to help create family-friendly workplaces. And so she's helping clients with their policies, their education, and their training. And she's got a background in HR, diversity and inclusion, so very similar to many of you on the line today. And importantly, a large part of Fiona's work does involve advice around policy and specifically leave. So I've invited Fiona, to share some of her thoughts on this issue of menstruation menopause leave a good idea. Fiona's also got 2 very active teenagers. and she's a community companion, visiting and supporting elderly who are socially isolated and vulnerable. So over to you, Fiona. Would love to hear from your experience.
Thanks, Thea, and thanks for allowing me to be part of the discussion. And as we sort of said at the beginning, the fact that we are having these discussions, I'm really thrilled. From a personal perspective, I'm postmenopausal, and so it's great that we're now having this conversation around support and just being open about these conversations more generally. And from a professional perspective, as Thea said, you know, I've got a background in inclusion, and it's really great to now see the topic of menopause and menstruation included in the agenda around inclusion and much more research on the topic as well, and loved Dani's work as well. I'm an endo sufferer myself and an endo warrior, we're called. So very grateful for the work that you're doing there. As Thea said, my role is very much about working with organisations and providing that best practice advisory support and guidance on supporting working families. Another part of the work that I do is also supporting organisations who have gone through the Family Friendly Workplace certification, which we launched in 2021 in partnership with UNICEF. So organisations can be certified against the National Work and Family Standards, which were developed to really provide employers with a benchmark of best practice and to help them support their employees meet their work, family and wellbeing needs. We've now had over 120 organisations be certified and nearly 450 be benchmarked against the minimum standards. And the reason I include this is because this year we did actually update the standards to include a criteria around menopause and menstruation, and specifically asking organisations if they have a policy in place. And Dani, you'll be interested in this stat that in the last 3 months, 30% of the organisations who've gone through certification or are about to complete certification either have or are committing to developing a policy on menopause and menstruation. So there is a real shift in this space. So it's really good to have that conversation. Thea just asked me to provide a very high-level overview, just to sort of, we can look at, you know, what support mechanisms are already in place, and you know, just around, you know, from a national employment standards, there are some minimum leave available, as most of you will be well aware, and that just is a good place to start.
Fiona, just letting you know, your sound's gone a little bit crackly. Do you want to maybe just turn your video off for the presentation, and we'll come back to you afterwards?
Sure. Okay, great. So you can still see my screen?
Yes.
Is that better?
Yes.
Great. So yeah, there are already leave entitlements in place. So, you know, but I guess what we're talking about is what other leave entitlements and whether we should include menopause and menstruation leave. What I think is important to note is that many organisations are going beyond the minimum standards and are proactively addressing the diverse needs of their people in a range of ways already. And this is just an example of some of those different leave types that are available to individuals within an organisation. But I guess today we're really looking at, you know, are the leave that's available enough, and should we be looking at additional leave for menstruation and menopause? There are some organisations that are doing a lot in this space already, and I'll come on to that in a little bit. But just back to Thea's point around what we learnt through the whole parental leave journey, I'm just going to give you a bit of a snapshot and then talk through some of those lessons that we've learnt. So one of the things that where paid parental leave started, or parental leave, maternity leave started sort of 10 to 15 years ago, even prior to the introduction of maternity leave. Some of you might not even be aware or have known about this, but there was a thing called the baby bonus. So there was no paid leave, it was a lump sum of money. But we then started to progress, and that's what when I had my kids, where there was no paid leave, it was a lump sum of money. But then it progressed into maternity leave to acknowledge the unique needs of women particularly through that postpartum period. And then over time, growing the acknowledged role of fathers play in caring and moving to paternity leave. This led to the move to removing maternity and paternity and moving to more of a primary and secondary carer labels, trying to break some of those traditional gender norms and allowing some more flexibility in who is the primary caregiver of the child. And then in more recent years, moving to removing those labels altogether and just having parental leave so anyone could actually access the leave available to them, and offering that flexibility on how the leave can be used within the individual and the family. So I guess from what are the lessons that we have learned in this time? Well, the reality is that this didn't happen overnight. It took time. As I said, you know, we're looking at around 10 to 15 years. It required sustained effort from many individuals, many organisations. It required legislative changes. So back to Dani's point, some of this actually only changed due to some of the legislative changes that were happening in the time. It required advocacy. It required a shift in societal norms. It required training within corporates, and again, particularly around that leadership piece and that raising awareness, and it required leadership commitment as well. And also in this period, organisations were really going through an awareness around the importance of inclusion and barriers to equality. So there were some real fundamental shifts both within the workplaces and within society itself. Some of the other lessons that we learned through this as well is that even when there was leave available, it didn't automatically translate to the uptake of leave. And this was a bit of a crucial lesson, particularly around encouraging men to take up parental leave, where some of those really deep-rooted societal norms and gender roles influence their decision to take leave or to take an extended amount of leave, with their concerns over their commitment to their career and career progression, because they'd seen that impact on women's careers. We also saw that workplace culture played a really pivotal role, again, to that leadership commitment and those role models within the workplaces, of leaders taking the leave themselves as well. So the change was not simple, it was multifaceted. It did require legislation changes, education, training, really well-defined policies and procedures, lots of open communication, the establishment of ambassadors, employee resource groups, and ongoing advocacy efforts. So I think there are some real things that we can take from that, we can learn for the introduction of whether it be menopause, menstruation, or a broader type of leave within organisations. Having said that, and as Dani's already sort of demonstrated, there are some organisations in Australia that are already providing specific menopause or M&M leave with a range of days available. So whether from 6 to sort of 12 days. And it's interesting to note that we've really only sort of seen the impact from Victoria Women's Trust so far out of the introduction of that leave. And as Dani said, there's been some push within Australia for the unions to provide leave as well. But what we have seen is a lot of organisations starting to offer broader type of leave. So not specifically MM leave, but a broader type of leave that can be used for menopause and menstruation, but can also be used for a much broader range of reasons. So for example, A2 Milk and AFCA provide 5 days women's health leave. They can be used for fertility and endometriosis. Deloitte have 5 days wellness leave, can be used for any sort of broad wellbeing leave. And Organon, as an example, provide an additional day's leave, 10 days leave on top of that 10 days personal carers leave, which can be used for anything. It could be used for caring, it could be for personal wellbeing, wellbeing of others. It can be used for, the QBE have life leave, which can be used for anything from pet bereavement to filling out forms to menopause. So I guess the value of having a broader type of leave, and what these organisations have just learned, is that it can help meet a diverse range of needs and is seen as much more inclusive. And we know that there is always pushback when new leave entitlement is implemented or when leave is expanded, such as paid parental leave. And there's always questions from individuals within workplaces around, you know, they might not be a parent or a carer, or they might not be experiencing menopause or menstruation. So what type of leave is available for them? So that sort of broader bucket of leave has sometimes seen as to be the solution for some of organisations around getting around offering that leave if they want to offer that leave, and then offering that for more broadly. It can also help with some concerns that women might have around being discriminated against, around being specifically having a specific type of leave for them. You know, again, we've seen that pushback around paid parental leave and the introduction of maternity leave as well. So there's a lot of the lessons that we've learned from there that we can look for this as well. And having, like I said, having a broad sense of broader leave can really help from an inclusion perspective. But there is a really big but around all of this, and that is the need of education awareness around how the bucket can be used. Because what we have learned is that without storytelling, without case studies, without leader role models, without people sharing their experiences, people will not take the leave up, or they don't understand that the leave is available for their particular situation. We've learned that with carers leave, for example. A lot of individuals don't realise that they can access carers leave because they're not sure that it's actually suitable for their particular situation. So sharing the stories and having that awareness building is really critical if you're looking at any type of leave, whether that's an specific leave or whether it's a broader type of leave as well. But also, to Dani's point, we can implement leave, but if we're not implementing it in a way that provides a broader support or awareness, it's actually not going to be as successful as an organisation needs it to be. So what we're seeing within other organisations, and the key one being around that access to flexible work, as Dani said, a lot of our clients that I've spoken to already feel they've got a really good flexible work culture, and that a lot of the needs of their people can be supported through the flexibility rather than additional types of leave, particularly if they can work from home. Also education and training, so both managers and employees, and just bringing into the consciousness of the business around menopause, menstruation or fertility, reproductive health more broadly, normalising the conversation, providing education and guides, and employee education. And like I said, we're seeing about 30% of those that are being certified are going to or have implemented a guide or policy, which might include things around facts about menopause. So you're providing that education, what support's available, signposting to external support, and getting people involved, people with the lived experience involved in the design of that guides and policies within the organisation. So it's very contextualised to the needs of the organisation. Workplace adjustments, we're seeing organisations including things to Dani's point, fans, comfortable uniforms, air conditioning, sanitary products, ice packs as well. So a whole range of sort of workplace adjustments to make more comfortable. Awareness sessions, having those conversations, panel discussions, and aligning it to dates of importance, such as World Menopause Day or Women's Health. Having advocates and ambassadors, and creating employee resource groups or linking to an existing resource group, and using internal comms to really share experiences and stories as well. And also access to employee assistant programs as well, for those individuals that might need it. So I guess from my perspective, the question around the lessons that we've learned a lot through that parental leave journey that I think we can really utilise and look at what's going to make a success for M&M leave or policies. It is really up to the organisation and their individual needs, you know, looking at their factors around industry, workforce type, and whether it's additional leave or whether it's a broader support that's available to them. But, you know, it's really around laying the foundations and creating that culture of support as well, so that individuals feel comfortable to talk to their leader, to talk to their team about what's support or adjustments that they might need, and recognising that, again, not everyone will need all of this. It just might be within some of our clients, they've noticed that it's minimal in terms of where they have implemented some of these support mechanisms, but the feedback that they get is that it's so enlightening to be able to feel comfortable to have the conversation in the workplace in the first place. So I guess from whether, to include leave or the different types of leave, again, like I said, it's really dependent on the organisation and their personal, their industry, what they've already got in place and where they are in it from an inclusion journey already. And some of the practical implications of things that have come up as well is around, if we implement a menopause and menstruation leave, where does it stop? Where do we keep adding more and more leave? And what does the impact that from a HR system as well, and all the different codes that from a payroll perspective? So they're just some of the things that we're hearing through our clients as well. So we're really seeing that broader bucket of leave. If you're able to offer that leave, it's got sort of some real advantages there.
Great. Thanks so much for sharing your experience, Fiona. And it's so helpful to see, both those examples of both the specific and broader leave. And thank you both for also just highlighting, even if no leave is offered, what the importance of just the normalising, the conversation, the education, the simple little adjustments. I think that needs to be the foundation of any policy. Because we're doing well for time, what I also just wanted to throw in just a couple of minutes was I just wanted to highlight the work of Dr. Sally King in the UK, and she wrote a really good article in The Conversation recently, actually saying why menstrual leave could be bad for women. And just in the spirit of, offering a whole range of perspectives, I'll drop that link in the text box, but I'll just summarise it for you in a breath. This was her argument. She says sending women home if they're having trouble with menstruation menopause means the workplace doesn't have to change. Secondly, she said this medicalises the menstrual cycle and positions it as an illness rather than a healthy process, and that most people who menstruate don't need a whole day off work. And she says that it conflates healthy menstruation with menstrual disorders. And I have seen a few policies who'll give the leave, but only like for severe menopausal symptoms, or if you have something like endometriosis or PCOS, so that's another option. She says potentially, and particularly perhaps not in so developed countries as ours, but it can position female employees as more expensive and less reliable. Doesn't reduce the stigma or taboo if you're sending women home. And this was the point I found rather spot on too. It places the onus of responsibility for women's health kind of back onto the workplace rather than our health system, and also our culture, which has not encouraged women to really work in tune with their cycles from an early age. So I just wanted to pop that up because I found, it was a well-written article based on research. So that's another bit of reading you might like to do if you're in this process of, thinking about what you'd like to do in your workplace. I'd like to throw open to you now. And if you've got a question or even an experience, some of you do have these leave policies in your own workplace, would love to hear from you. So we'll just keep an eye for hands up. And when I see that, I'll call out your name, or if you do want to drop something in the chat box, feel free to do that as well. So has anyone got some comments, reflections, experience to share? What's working for you, what's not? If anyone is on the line who is implementing these leave policies, love to hear from you. Not seeing any. Do I see a hand? Yes. Victoria, Vicky, go for it.
Hi, everyone. I thought that was interesting about the looking at there are articles which are actually, I guess, pushing back on discussing menopause in the workplace. There was one in the Sydney Morning Herald last week, an opinion piece written by a woman that said, "Want to help women's career prospects? Shut up about menopause." That was actually the headline. So I kind of find it interesting that we're now almost seeing that pushback of discussion of menopause in the workplace, combined with using some information that was, I think, released by the Dani Howe Foundation the other week as well, which was kind of hinting that not all that many women actually experience issues with menopause. So why are we focusing on it in this way? And there's a counter backlash to that, essentially, that women are saying, well, it's not all women who suffer difficulties with menopause, but there should be accommodations for those who do. So I'm just interested, I guess, to hear what Danielle and Fiona think of this kind of counter backlash to bringing this out in the open. Me personally, I think the more we talk about it, the better, and the more we understand the support networks, the better as well. But it's just interesting to see this countering of that.
I'm happy to jump in quickly and then get Dani's thoughts on this as well. But I think it's similar to the introduction of paid parental leave as well. It was seen that women were going to be more expensive. They were going to train all these women and they're going to leave the workforce, and so it was going to have this big impact on the workforce as well. And obviously we've gone through that, and that isn't the case. And the additional benefit to the economy for having more women in the workplace and for longer periods of time far outweighs a lot of those arguments. But personally, from what I'm talking to with organisations, there is definitely a real desire to want to have the conversation in the workplace. There's very little pushback from the companies that I've spoken to that are not wanting to have that conversation. In fact, they're really sort of gobbling up anything that they can see around, how do we have the conversation? How do we support leaders to have the conversation? How do we implement a guide, do a policy? What does it look like? So I'm not necessarily seeing that pushback. I think there's always going to be those people that love to have the opposite side and opinion, and we sort of counteract that with, we understand it might be uncomfortable for some people, but we've got the research, we've got the benefits, we know the benefit of inclusion, and hopefully what that will do is also normalize it for men to talk about their health needs in the workplace too. This isn't just a women's issue. This is about everyone's health needs, and men have much higher rates of heart disease. They have much more higher rates of suicide. So hopefully we can really open up some of those conversations more broadly about people's well-being, and stop making it just around women's health, for example.
Yeah. Did you, Dani?
Yeah, I was just going to add to Fiona, that was spoken so well. And yeah, I just wanted to speak to that fear of hiring. It's so interesting because often you'll hear that from people who are seniors or execs, and often a lot from anecdotally from a lot of the preliminary research that we've done, a lot of it does come from senior women or people who do menstruate or have transitioned through menopause, who are kind of like, well, this was my experience, so your experience, like, you need to tough it out. And those people have been able to get to these positions of power, be able to be senior leaders, because they might not have actually as severe symptoms. They never had to have extra supports or accommodations. So it's really trying to do the education around that mind shift. And I think, I think we're always going to get a little backlash anytime you introduce policy. But a really interesting way to propose it is a lot of some of these larger organizations are recruiting young people right out of university. So they're investing in them and hoping that they'll have a career with this organization for their entire career. And a lot of the young people, a lot of this new wave of employment are actually looking at what are the policies in place. Do you have menstrual leave? Do you have well-being leave? So it's actually making people much more of have much more of an edge on recruitment for young, talented employees. So sorry, I feel like I had so much more to say, but Fiona had definitely really touched on it. I mean, what we're finding from the impact data that we have is that when these policies are in place, it actually encourages additional policies on top of that to really people to start to speak up about their own health and their own support. So yeah, it kind of has that trickle-on effect, I think.